Did you know that dengue fever, a painful mosquito-borne disease, affects about 400 million people worldwide each year, with 96 million resulting in illness? It's a staggering reality that we must face. Most of these cases are found in tropical areas, yet outbreaks have been reported even in the United States, particularly along the Texas-Mexico border and in southern states. This disease is not just an inconvenience, it's a serious health threat. It's transmitted through mosquito bites and cannot be spread directly between people. Symptoms range from high fever and headache to joint and muscle pain and even rash. In severe cases, it can lead to life-threatening conditions known as dengue hemorrhagic fever and dengue shock syndrome. Despite ongoing medical advancements, there is currently no specific treatment for dengue infection, and prevention primarily involves avoiding mosquito bites and eliminating their breeding sites. The reality of dengue fever is indeed shocking. It's a global health concern that needs our attention. Dengue fever, caused by 4 closely related viruses, is a major health concern in tropical areas. Now let's delve into the intricacies of this disease. Dengue fever, a painful and sometimes deadly illness, is primarily transmitted through the bite of a mosquito. However, not just any mosquito. We're talking about the Aedes mosquito, a pesky little creature that prefers to feed during the day. These mosquitoes are the unwitting carriers of the 4 closely related dengue viruses. When a mosquito bites a person infected with a dengue virus, the mosquito becomes a carrier of that virus. The cycle continues when this infected mosquito bites a healthy person, transmitting the virus into their bloodstream. It's important to note that dengue fever can't be spread directly from person to person. It's the mosquito that is the go-between. But where is dengue fever most prevalent? It's a global issue affecting nearly 400 million people each year. However, it's particularly rampant in tropical and subtropical climates like Southeast Asia, the Western Pacific Islands, Latin America, and the Caribbean. Even in the United States, outbreaks have occurred, especially along the Texas-Mexico border and in the southern states. The impact of dengue fever is vast and widespread. While the majority of those infected will recover, a significant number, about 96 million people, end up with a severe illness. In extreme cases, the disease can progress to dengue hemorrhagic fever, or dengue shock syndrome, both of which can be life-threatening. Despite its widespread prevalence and the severity of its symptoms, there's no specific treatment for dengue fever. The primary approach is supportive care, treating the symptoms to help the body recover on its own. Dengue fever, a mosquito-borne disease, is a global health issue that impacts millions of lives every year. Understanding what dengue fever is, how it is transmitted, and its global impact is the first step in combating this disease. Stay tuned, and we'll delve deeper into the symptoms, diagnosis, treatment, and prevention of dengue in the next scenes. High fever, headache, joint and muscle pain, and rash. These are the common symptoms of dengue fever. Let's dive a little deeper into these symptoms. The onset of dengue fever typically begins with a high fever that can reach up to 104 degrees Fahrenheit. This fever can last for 2 to 7 days and is often accompanied by a severe headache. In addition to the fever and headache, an individual infected with dengue may also experience significant joint and muscle pain, earning dengue the nickname of breakbone fever. This discomfort can range from mild to severe and can affect any part of the body. Another common symptom is a widespread rash. This rash often appears during the first or second day of the fever and may spread over most of the body. It typically starts as a cluster of tiny red spots, but can develop into larger patches. The rash, along with other symptoms like nausea, vomiting, and swollen glands, can make an individual feel quite unwell. But the symptoms of dengue can also vary greatly. In some cases, they can be mild and can be mistaken for symptoms of the flu or another viral infection. This makes recognizing dengue fever quite challenging, especially in the early stages. In severe cases, dengue can progress to what is known as dengue hemorrhagic fever, or dengue shock syndrome. These conditions can cause bleeding, blood plasma leakage, and low platelet count. They can also lead to shock, organ failure, and even death if not treated promptly. It's crucial to remember that these severe symptoms usually occur after the fever has subsided. It's a critical period when the disease can take a turn for the worse, and it's essential to seek medical attention immediately if these symptoms appear. Knowing these symptoms can help in early detection and management of dengue fever. Remember, dengue is a serious illness, but with early recognition and proper medical care, the severity can be reduced. Dengue fever is diagnosed through a blood test, and while there is no specific treatment for the infection, it can be managed. When a person presents symptoms of dengue, medical professionals will typically conduct a blood test to confirm the diagnosis. This test checks for the presence of dengue virus or antibodies produced in response to the infection. Once dengue fever is confirmed, the treatment is focused on relieving the symptoms and maintaining the patient's fluid balance. There is no specific medication to treat the dengue infection itself, but the symptoms can be managed effectively. This usually involves getting plenty of rest, staying well hydrated, and taking over-the-counter pain relievers to help with fever and pain. However, aspirin and ibuprofen should be avoided as they can increase the risk of bleeding. In severe cases, hospitalization may be required to closely monitor the patient and administer intravenous fluids or blood transfusions if necessary. Remember, early detection can make a significant difference in the course of the disease and the severity of symptoms. Early detection and proper management are key in dealing with dengue fever. Prevention is always better than cure, especially when it comes to dengue. This is a saying that rings true for many diseases, and dengue is no exception. As we know, dengue is transmitted through mosquito bites, so the first and foremost step in prevention is to avoid these bites. One can do this by using insect repellent, wearing long-sleeved clothing, and installing window screens to keep mosquitoes out of homes. Moreover, we can take a proactive role in eliminating mosquito breeding sites. These pesky insects love to breed in stagnant water, so by regularly draining and changing water in plant pots, buckets, and other containers, we can disrupt their life cycle and reduce their population. Now, let's address vaccination. There is a vaccine called Dengvaxia, but it's only approved for adolescents who have already been infected with dengue. This means that for the general population, there's currently no vaccine available. Therefore, prevention through the methods we discussed earlier becomes all the more critical. In conclusion, while we may not have a vaccine for everyone yet, there are still many actions we can take to prevent dengue. We must take proactive steps to protect ourselves and our communities from dengue.